Hi everyone, I'm Hisham Salahuddin and I'd like to welcome you to the recap of the late-breaking trials from the last day of the annual SVIN 2025 conference. In this short video, we'll walk through some interesting data from middle meningeal artery embolization studies and early clinical results that wrapped up an exciting week of neurointerventional science. A subgroup analysis of the large core Tesla thrombectomy trial examined patients with ICA or M1 occlusions and an aspect of 2 to 5, looking at conscious sedation versus general anesthesia. In a real-world cohort of the Tesla large core thrombectomy trial, conscious sedation was associated with better functional outcomes than general anesthesia, suggesting that anesthesia effects may vary in trials not specifically designed to evaluate hemodynamic management. Dr. Rami Morsi also presented a two-center experience using the first 7 French 087 inner diameter Perius New Glide radial catheter, the first new PTFA-PFA-free catheter of its kind. The reduced wall thickness allows for large 6 French systems via the radial route. Among 150 interventions, only 2% required conversion to femoral access, all for ischemic stroke cases which required super large bore catheters. The catheter demonstrated improved trackability, strong support, and no access-related complications. Dr. Davies presented an analysis of the surgical and middle meningeal artery embolization arm of the EMBOLIZE trial, examining embolization timing relative to surgery and the type of surgery performed for subdural hematomas. Among 197 patients, 107 underwent MMA embolization first and 78 had surgery first. All treatment failures occurred when embolization preceded surgery. The therapeutic benefit of adjunctive MMA embolization was greatest in patients treated with burr hole drainage compared to craniotomy, and significantly fewer serious adverse effects occurred in the burr hole group. Dr. Shoeira presented an analysis of the vascular penetration in middle meningeal artery embolization from the membrane study. Good penetration was defined as proximal ligation or embolization not reaching the midline, while excellent penetration extended to the midline or beyond. At 6 months, outcomes such as reoperation and residual hematoma showed minimal differences between good and excellent penetration groups. Given the limited sample size, an individual patient-level meta-analysis across randomized controlled studies may be necessary to determine the minimum effective degree of vascular penetration for MMA embolization. A sub-analysis of the SUMMIT MAX trial comparing the super large bore high point reperfusion system with the Vecta aspiration system found significantly higher rates of first pass effect with the high point, with the performance gap most pronounced at the 3 highest enrolling sites. Dr. Linfante presented early clinical and technical outcomes from the real-world use of the Surpass Elite device in 135 patients with skull base and intracranial aneurysms. There were no implant delivery failures, an 11% rate of balloon angioplasty, and no device-related complications. At 6 months, there was 1 asymptomatic occlusion and 1 asymptomatic stenosis, with a Raymond occlusion 1 rate of 74%. Thanks for joining us for today's late-breaking SVINCAP. We hope you enjoyed this year's conference and we look forward to seeing you at next year's SVIN annual conference in Las Vegas.